quite interesting how that's happened. So that's how I've attended a lot of
yeah, right. It's very good for brand development, but it's not good for actual business, because in any case, in any case, actual business, at least in the United States, people do through connections, corruptions, excuse me, and all this stuff, and it's impossible to do through the Zoom.
Right. Although I hear it's changing a little bit, but it all depends. We'll see. It's probably going to all go back the way it was before. So with some Zoom as well, I think. So.
Right. I was advised by Prank to change my name because speaker is not good.
Oh, so am I. Before it was. How did you do that? I don't even know how to do that.
Go to some three dots on your.
Oh yeah, okay.
On the picture, and
rename.
Rename.
Look at that.
Hello, gentlemen. I'm back. Thank you so much.
All right.
I enjoyed your interaction. I mean, you guys met in the past, but could not recall that, and now fate brings you to the
That's right.
And here you are doing networking when I'm away.
Hey, that's the power of technology. So
yes, absolutely. I mean, I am a big fan of technology. Had it not been technology, we could not just see each other and talk about different topics, right? Right. Great.
Well, I could tell. I mean, it looks like your company is very much into it, and then you got these webinars. I was going to look into them a little bit more, but you do a wide diversity of subjects as well. So
yes, we're going to be touching about all of those topics as well. And one of the primary reason why we could delve into different topics, different subjects, is because we are into IP, and
and IP is all over.
Right. So it's all over, right? You talk to different people from biotech, you talk people from high tech, you talk people from defense, you talk people who are making submarine and warships. Right, and that's how we've been doing. That's how we have been evolving ourselves and enjoying. Hey, Douglas, how are you doing today?
Oh, I'm good, Priyank. And you?
Doing fantastic. Lovely. Good to see you, man. Douglas, how about we change your name? Right now, it's coming as a speaker. Do you want to change that name to Douglas or something else?
Yeah.
You know how to change that?
Let me try. Let me do it.
Yes. You can just type, click on rename, and if you want to add your company name, your your public health research organization, you can do that as well.
Maybe I'll do that.
Yeah, of course. Go ahead. People are gonna see us on LinkedIn, YouTube. People are gonna watch, participate and interact with us online over Zoom as well. So go ahead, put your company names out there.
Okay.
Excellent. So we have been conducting all these webinars for almost 1.5 years now. The moment all of us were hit by this pandemic, what we decided is now we cannot travel abroad, right? Otherwise, I would have been in the US in last year April, in Singapore during May, and so was the travel plan. But because of COVID and the restrictions, we could not. I mean, we are just, and we cannot even move out of our own home.
So you were going to be physically traveling to these locations?
Yes,
really?
to meet people like yourselves.
Face to face.
Right. To meet people like yourselves, and to meet clients, to do networking, and to, of course, I love travel. So to travel as well. But unfortunately, we could not do that. So we thought, why don't we put together a webinar where we invite folks from different industry, different geographies, and different sectors, and we share out our learnings with them, because it's most important part is to share learnings. Yes, it's perfect. Thank you so much.
One question. Here. I have a fan.
Yeah, sure.
Blowing at me. Is that noisy? Do you hear the fan, or should I turn it off?
I don't hear any noise. It's perfectly fine on my side.
When you're speaking, Frank, when you're speaking, there is a noise.
Okay, from my side.
Also,
okay.
Yeah, from your side.
Yeah.
Also, your light is bleaching.
It's blinking in your background.
Blinking, yeah.
Yeah, it's fuzzy and blinking.
Fuzzy?
Well, it's not just fuzzy, it's also flashing. It's still flashing. It's kind of distracting.
Okay, the background is flashing, right?
Yeah.
It's because of the fan. Yeah. All right. Now I have taken care of it. It'll become stable in a minute. All right, perfect. So we have everybody, and thank you so much. Before we hit and start the webinar, do you have any questions, anything else, or should we just go ahead?
Just start and we will.
Yeah, I've seen the other two, so I'll have a pretty good idea of what to expect.
Hello.
No, nobody will join us because I expected more people. No.
I think the other people are just participants.
Okay.
Yeah.
So, Prank, you will ask questions and you will manage, right?
Maybe. Hello, Priyank.
Oh, hello, Douglas.
Hello.
Yeah, I haven't had a chance to say hello to you.
Nice to see you, Dennis.
Same here.
Yeah, same here.
It's pretty neat to connect with people across the world. So I think that's really cool.
Yeah. Yeah, it's cool. And I'm very happy because I'm sure I'm going to learn a lot from you guys because yeah, I'm sure that you have a lot of experience on this issue of health tech. Yeah.
Well, I'm looking forward to finding out more about you and what you do. So.
Pardon?
Excellent. Now we are about time. Guys, if you are ready, I'll give you 3, 2, 1, and we will start the webinar. You all ready?
Ready.
Sure.
Excellent. Perfect. Why don't we click our first picture before we jump to the webinar?
Yeah.
Yeah. Thumbs up.
Yeah.
Any marks? All right. Cheers. Let me just click that. Thank you. All right. Perfect. I have it. 3, 2, 1. Here we go. Good morning, good evening, and good afternoon, guys. Thank you so much for being here. I am Priyank Khandelwal, your host for the day, and we are here at day 3 of Photon Legal's Future of Health Tech Webinar Summit. With me today, we have Dr. Leon Eisen, Douglas Ban Masom from Africa, and Dennis Koverzin from Canada. Guys, today we'll be talking about different aspects related to healthcare and the digital transformation which AI is doing in the health tech space. Today, we have 4 eminent speakers with us. Everybody is leading in their respective organization, and each and everybody has made a dent in their career in their respective jurisdiction. So let me welcome all of you on board. Thank you so much for keeping your valuable time for us. And I'm sure our discussion is gonna be fantastic. A lot of people who are watching us live on LinkedIn, YouTube, Facebook, everywhere are gonna learn so much with what you have in the store for all of them. Thank you so much once again. Let me quickly introduce all of you. Let me start with Mr. Dennis Koverzin. Dennis, my friend, is from Canada. He's the president and co-founder of Life Elevated Inc. Life Elevated Inc. is into digital healthcare and wellness space. These guys specialize in voice assistance and provide care for people who are into medical field. Dennis has a long experience, which ranges from sales, be it e-commerce, telecom, even Dennis has assisted a lot of startup companies in creating their B plans as well. Dennis has been helping them to raise funds, move from step A to B. And now he is creating virtual assistants for family care. specifically for senior citizens as well. Dennis, thank you so much for coming on board. We're delighted to have you.
Thank you very much. I want to thank you all as well for inviting me to this e-summit. I'm looking forward to partake in it.
Excellent, fantastic. And yes, one more interesting thing about Dennis is he is a sports person. He's an athlete, and with this Olympic going all around, he was also practicing some of his moves and trying to break his own record as well.
in my heyday in high school, I was a javelin thrower. Actually, India
Lovely.
has a gold medal from javelin.
Yes.
So that was pretty neat. Congratulations, India.
Thank you so much, Dennis. Thank you so much for bringing that point here. Yes, we have the only gold medal this time from Neeraj Chopra, and it's in the javelin throw. So yes, good connection there.
Yes, it is.
All right. Next, we move to Dr. Leon Eisen. Dr. Leon is a PhD in quantum physics, one of the rarest topics which people would typically choose in this industry right now. But yes, so what Leon has been doing is he's an inventor for almost 30 patent applications. He has published almost 20 research publications as well. He's an entrepreneur, speaker, and startup mentor, and he's passionate about healthcare transformation. He's been into this health tech space for more than 15 years. And that's why we have him to share his knowledge, to share his passion about transforming home care for people with severe chronic diseases. I mean, right now, Dr. Leon is leading Oxytone Medical from idea stage to he has also got several rounds of fundings, and now he is at the growth stage. Prior to Oxytone, he was also working with several other medical device companies as an engineer, senior consultant, and different positions like executives as well. With all of this thorough knowledge, I'm sure everybody has a lot to learn from you, Leon. Thank you so much for coming onto the panel. We are delighted to have you.
Thank you. I'm happy to be here and share everything what is valuable for your audience.
Thank you. Thank you so much. Next, we have Douglas Bang Masom. Douglas is from Cameroon. Douglas comes from a different background altogether, where we have people from engineering background, we have Dennis from sales, e-com, telecom sector, while Douglas is working with an NGO. It's into public health innovation, and he's working for people in the Africa and using technology, using innovative solutions to improve their health, and also onboard a lot of health tech startups which are solving health-related problems for African people. Douglas, we would love to learn from your experience. How are the situations in Africa? How are you using innovations and tech startups specifically to help your cause? Thank you so much for coming to the panel. We are blessed to have you.
Thank you so much, Priyank. It's my pleasure, and thank you for inviting me to this webinar. I'm very happy to be here and to represent Africa on this workshop. Yeah,
fantastic. Thank you so much, Douglas. I love you all. I mean, the way you have progressed in your life, the way you have excelled in your experience in the professional career as well, the way you have identified what you are doing and why you're doing. I mean, I've gone through all of your profiles and I'm blown away. So that's the only thing I can say. I love you all.
Thank you.
Thank you.
Now, so let's start our discussion. I mean, the reason why we are here is to share how AI or how health tech companies are disrupting this healthcare or medical system altogether. So for last 1.5 years, we have been experiencing pandemic, and we are all seeing the changes which this pandemic has brought to the world. One of the changes is that we are connected across over a mobile or a laptop through an internet, sitting across in our respective homes, right? We are connected across the borders and still able to talk, conversate, and do this webinar live thanks to Zoom, thanks to technological disruption. Similar way, a lot of innovations are happening in the health tech space as well. So with this philosophy, with this thought, we thought, why don't we bring together people who have been successful in their respective life and share their knowledge so that rest of the folks across the globe can learn from your learning. Okay. So thank you so much. Let me just start this webinar by asking simple question to Leon. Leon, you have an excellent academic record. Uh, you also come from Israel, where innovation is imbibed in each and everybody. I've been to Israel myself. I've spent the summer of 2015 in Israel at Tel Aviv University, and I've seen how college folks take innovation so seriously and end up having their own startup, which then they further go ahead and sell it to rest of the folks. So, Leon, you could have easily got a cushy job. I mean, you were already working with so many organizations in the past. Why did you choose entrepreneurship and why health tech?
Oh, this is important because it's some kind of personal issue. I chose medtech because I decided to bring some value to our society, because before I was a scientist, and as you know, why scientists and professor has a low salary? No, with respect to entrepreneur or somebody else, because what professor is doing will be applied in 50 years mostly, yeah? So just take their salary and cut in 50 years slice, and you will have a very small salary for professor. It's a joke, but actually, I decided I was invited to manage development of optical systems for medical devices after I finished my scientific career. And I found it not only exciting, I found it some transformative, because we're living in a transformative time. And today, transformation happens in all levels of our society, on a personal level, on a customer's level, on industry level. And finally, all these transformative activity just conjunct or released in growth of different industries, and healthcare is not an exception. Unfortunately, in healthcare, for the last years, many last year, I didn't see a lot of disruption transformations. Mostly it's happening some efficiency transformation. So money make money, like once Professor Clayton Christensen said in his very important book, Innovation Dilemma, money makes money. And this is what happens as well in medical industry, because the medical industry is very tough for innovation. So it's better and easy to go to make it all flow, workflow, everything more efficient than more innovative. And this is what this is my why issue. So this is what I was going to transform. And I was right, because COVID just revealed that there is a huge line, bold line between, for example, healthy people, people with one chronic disease, and polychronic disease people. So just imagine, today, we have exactly the same devices, exactly the same, almost same, similar care plan for patients with one chronic disease and patients with 5 and more chronic diseases. Independent on risk level of these patients. So, and this is very, very much, so it's not holistic, it should be holistic approach. And today they just could differentiate by prioritization of each disease. Today has a problem, which doesn't have problem. So we don't have holistic approach, because all these devices, take telemedicine, what we get all the time some improvement in efficiency of telemedicine without any innovation in telemedicine. So what does it mean improvement efficiency? If we have chronic patient, diabetes, patient receive glucometer. If patient has 5 chronic diseases, patients receive 5 devices. Now you ask patient to make measurements with all these 5 devices, blood oxygen saturation, oximeter, blood pressure monitor, all these stuff, and send this data to the call center or to the physician. So it's totally not holistic, one-time measurement. You don't know what happened to this patient. And this is the same applied to one patient, to one chronic patient, to one chronic disease patient, or the polychronic disease patient. Same approach. because of COVID, we found that there is a huge line between these type of patients. So for example, okay, you make it more efficient and more efficient. You have 1,000 telemedicine company, each company do exactly the same, but with different level of implementation and efficiency, but there is no innovation. Now innovation came. What does it mean? It's some devices that enable to measure all these vital signs from the same place continuously and save patients in real time. It didn't happen before, but it's very tough to penetrate into the market because it requires to change the mind of market players from some efficiency approach to innovative and disruptive approach. So this is when I realized this just driven my wish, my desire to make difference.
Fantastic. I mean, this is an awesome vision statement which you have, and your desire. You have clearly understood that, okay, there are multiple chronic diseases and people have generally polychronic diseases. I mean, they would have at least one or two more chronic diseases, and there is no single device or a medical device which will let a patient diagnose or test his disease level by using a single device. And then there you are, the Oxytone Medical, which is helping patients to do diagnosis on multiple chronic diseases on a single device.
Right, and this is not only because of device, because you have real-time data, a lot of data, multi-parameter, multi-channel data taken in real time, synchronously. You can apply some holistic approach, artificial intelligence tools, build some indexes. So you don't have like today, okay, call patient, tell me what kind of oxygen saturation you have today. 96? Oh, bad. 98? Very good. Thank you. Forgot about it. Now what? I have to ask all these questions all the time. Now I don't care about what oxygen saturation specifically this time at these patients. What I care about some compound index that is that contains all these parameters at once with some different weights applied. And I can apply this index. I can holistically understand the patient health status. And this is made of FDA cleared, made of medical grade data, not Fitbit data that is poison for any artificial intelligence tools. And people try to do it, but it's poison, it doesn't work. So this is the future. Now we're talking about voice recognition in addition to all these data. So we're talking about multi-parameter data that could be vital signs, biomarkers, it could be voice recognition, it could be everything that deliver information about patient health status. Then we can combine it in one index. We can have real-time index. We can follow this index. And at the same time, this innovation will also bring more efficient management of these patients. Patient not die, patient do not get into the hospital because you have prediction tools to recognize based on these indexes. And this is the future. How to implement this? It's a different story. We try our way. Somebody else, some company, there are great companies try it in different way. But finally, this is the trend.
Fantastic. Honestly, yes, this is the trend. This is what the future of health tech is all about, identifying and analyzing data, multiple data from different data sources, and pulling out a meaningful index, which will help the doctors, the healthcare, and the patient to take a decision at the end. Excellent. Thank you so much, Leon, for sharing that. Moving on to Dennis. So Dennis, Leon mentioned very fantastic point that money attracts money, right? And it is...
But yes, I agree 100%.
True. I mean, of course, money comes first and then the management, right?
Right, exactly.
So money attracts money. And the moment I said this, Douglas started to laugh. he had a smile on his face. So yes, I mean, that's true, right? Money can help solve a lot of problems in the world. So while you were enjoying your life by advising a lot of startups, working in health tech, working in telecom, e-commerce, and even your sales gig in the initial times, how did you land up doing voice assistant care, healthcare based system, and running company like Life Elevated? what's your story? What's your journey?
What's the journey? Well, it all depends how far you want me to go back. Okay, so you brought up money. Okay, I'll come back to money. Okay, but my journey is really about the health of myself and my family. Okay, so what I have to say is not, it applies to everybody. Okay? Health is universal. It applies to everybody. Okay, so in my family, for example, my dad had diabetes. He didn't look after himself very well. I had my own health issues. My brother got cancer. Okay, so all of these things had affected me very much. So as I progressed in my career in the technology field, I just said, I observed, first of all, the significance of health, but also the significance of the support of family and friends, and also of positive motivation. Now, positive motivation behavior. So all of that came together one day when I said, okay, I want to start up a company. I want to apply my technology knowledge, and I want to apply friendship and motivation. And that's how Life Elevated was created. I combined all of that together. From that, when we first started the company, my business partner and I, my brother, we're both electrical engineers. So we got together and we said, we're going to start up this company. It's called Life Elevated Inc. What are we going to do? We're going to we're going to address health, wellness, and quality of life. Sometimes it's called whole health. Okay. So how do we do that? So we sat down and we brainstormed for weeks. Okay, what would be the ultimate solution if there were no limitations? And that's the creativity, that's the innovation part of it. So after much discussion, we said the ultimate solution to help a person would be a friend who cared for you and dedicated their life to help you every day with your health and your behavior and motivation and all of that. Of course, that wasn't realistic. But what we did is, okay, what we're going to do is we're going to create a virtual friend that has health and wellness smarts. And that's how we came up with the concept of the virtual friend. And so for the last couple of years, what we've been doing is we've been creating a virtual friend. So a virtual friend is a smartphone app that uses verbal interaction. As Leon mentioned, okay, voice is becoming a big issue with respect to the whole world. I mean, there's now, customer engagement through business. It's really growing there. But voice is also going to be a future within the healthcare field. So that's what we're doing. We're creating a verbal or a virtual friend based on voice. And so the idea behind there is that it helps a person. It's with the person all the time. Your smartphone is with you most of the time for most people. Half the world, 3.5 billion people have a smartphone or a feature phone. And what the virtual friend would do, it'll help a person in four main ways. Number one is it would help a person with self-care. This is things like exercising, eating healthy, and those kind of things. So it's going to help them with that. Second component that we came up with or determined that's important for health and well-being is mental health or mental wellness. Everybody will experience some mental health episode, anxiety, negative thinking. Through voice interaction, we help the person with mental wellness. And the third thing is well-being. What is well-being? Actually, psychological well-being is actually a defined issue or item in the healthcare field. It basically applies to happiness and life satisfaction. So so our virtual friend also helps a person with that. And on top of that, we provide the virtual friend verbally obtains parameters like weight and all of that verbally.
Okay.
What we're looking for is a low-cost solution to help a person look after their health. That's a summary.
Excellent. I mean, this is great. Low-cost solution. Look, basically a friend, a virtual friend who will look after the person when nobody else is there, nobody else is around. And this virtual friend is just basically a mobile phone, right? All you have to do is give the voice commands, and your friend is there and it's active. Awesome. And I also like your motivation motivation, the desire to come up with this point, and the name Life Elevated itself comes from the motivation. So you want to elevate the life of the people who are using it, and that's a strong why. And I really like it, Dennis.
Thank
Excellent.
you.
You also mentioned the point that friends and family care is what was your starting point, and the reason why you pursued this idea. So basically, the why is very personal, right?
Very much.
So this
Actually,
is awesome.
our inspiration was our mother. Okay,
Okay.
so our first target market was actually for seniors. Okay, and
Mm-hmm.
our mother was our inspiration. She lived 300 miles from me. Okay, so I was a virtual family caregiver for her for years, and then in her last year of her life, I was a personal. I moved in with her and I looked after her. But over that period of time, my brother and I applied technologies to communicate with her and to help her. In fact, our first product was a voice-based or a telephone-based service that would give her reminders. So that's how I started.
Excellent.
But
Excellent.
and in fact, that could still be a value. Okay, but we moved on into more sophisticated technologies. So yes, that started with family and the inspiration of motivating and helping people and helping seniors.
Thank you so much, Dennis, for touching that story. I mean, honestly, to all the viewers who are watching us right now, please take an inspiration from Dennis. I mean, look at Dennis. He observed the problem. He observed the situation which was happening around him in friends and family. In fact, the conditions which he has to go through, in his own family, and by discussion with his brother, he could come up with a technological savvy innovation which is now helping everybody to elevate their lives
Mhm.
as per life elevation, and helping the world to make a better place. Thank you so much, Dennis, and I love your inspiration. I'm sure a lot of other folks who are listening to you right now will also get inspired and look for problems and tech solutions which can solve them, which can help them to solve the problem the way you did. Excellent. Thank you
Great.
so much for sharing that. I have a question to Leon on this. So, Leon, Dennis could come up with the problem which was very personal to him, and he could come up with a solution which is helping rest of the community at large. What was your problem identification moment? How did you come up with oxytone? Why wireless industry? Why wearable industry? And why not other health industry?
Okay, I have some personal story. For the many years working in the medical industry, we developed very unique technology that enable to analyze blood flow in real time and understand blood analytes. And at the same time, I just got the message that my father collapsed on the street being 3 hours after discharge from the hospital. So I called his physician. Physician said, no, I don't know what happens. I saw him 3 hours ago. He was okay, now collapsed. I don't have any data. So triage, the ambulance came, they did some triage. It took about 15, 20 minutes. And I understood, okay, what happened? So patient released from the hospital is not connected anymore. And this is a mental problem. And actually what happened, it was a mental problem. It's not physical problem because he was afraid. And his fear just led to collapse. And people coming home from the hospital, they on discharge, they're afraid because for a week they were connected. People just were caring about him. And suddenly he is alone. And this is a real mental problem. So we have to give him something that continue connection like in hospital, continue to provide data like in hospital, at least for the first, I don't know, for the first 3 days, for the first week. But very interesting what we realized during our clinical trials. This is some side story, I would say. When we give patients our product, it's actually a wearable product, but it's not exactly wearable. It's not a watch. It's a halter. We call it Oxytone Ulnar PPG halter because it has specific placement. It requires some training. It's a medical device. It doesn't look like a watch. It looks like a medical device. And it has multi-parameter that generate on medical grade. So it's a halter. It's not wearable or something like this. And so patients who receive our product and discharge from the hospital home in the beginning of the dischargement procedure, okay, that's okay. They like it and they have full peace of mind after discharge. So we solve mental problem of discharge that really sometimes lead to collapse because of a lot of stress happens. But people who got our product day before, they don't want. And this is amazing. And we learn this and we plan to make paper about it because we understood that people actually do not like hospital. They don't like hospitalization. And we figured out that everything what they receive in the hospital, they consider like a part of their life in the hospital. They don't want to take it to their home, despite the fact that these could help. Very interesting observation, and we try to understand even better now.
Interesting.
Behavior.
I'm so sorry. So sorry for your loss. But yes, again, an interesting story, interesting observation you guys made while running the trials. So yes, then Leon, I have a follow-up question to you on that. So Google bought Fitbit for almost $2.1 billion. And this wearable market across the globe, as it stands on till 2020, is valued at around $28 billion, which might even just explode and reach up to $100 billion in next 5 to 10 years. How do you see oxytone playing a pivotal role in this whole journey of wearable across the globe? Where do you position yourself?
I don't see it all. It's not our market. You can, at the same time, you can offer me the market of avionics, for example, or something else, market of, I don't know, computer market. No, it's not our market. It's a different people. It's a wellness market. It's a different behavior. Device should look different. We are in the market of medical devices. So our market is market of where Massimo, where Philips, where GE. So this is our market. And mostly, if we're talking about market product proposition and market placement, this is mostly like a halter, as I said. So it's a halter. It's for patient screening, for patient continuous monitoring. If we're talking about hardware, but you cannot separate hardware from the software. And here also wellness market is a totally different stuff. They're looking for different things. And we're looking for medical things. We're looking for hospital at home. No Fitbit there. Did you see Apple in the hospital? Never. And you will not see this in the hospital. So this is totally different market. We do not consider our device like wearable, or any halter with 12 leads you can consider here like wearable. Is it wearable? No, it's wearable. You can wear it. Patch wearable, you can wear it. But nobody make market positioning these devices like wearable. Same with oxytone. It's a halter that continuously collects PPG halter, continuously collects multiple patient parameters and deliver this parameter to specific brain, and this brain analyze this parameter in real time, release report on demand if you need some report. And we also develop very unique, innovative business model. We do not sell devices, we do not sell anything. Our patients subscribe for reports. We call it clinical reporting as a service. It's some kind of SaaS, but it's some derivative of SaaS, clinical reporting as a service, CRAS. So our clients, they subscribe to 10 reports, 500 reports, 1,000 reports. And they could generate these reports. It could be sleep apnea stress report. It could be post-COVID 7 days assessment report, different type of reports, and they buy it.
Interesting business proposition altogether. I mean, you're not competing with the big giants like Google, Apple, or even Fitbit. You have your own domain identified, and you have a very fantastic subscription model. So I love it. I'm already sold on the idea.
I can tell you more. We explore so-called Xerox model.
Okay.
Because for one device could be used for, I don't know, if it's sleep apnea for 150 patients per year. If it's minimum 12 patients per year just for one device. So if they buy one device, they also not buy, they subscribe for the package with one device, they could subscribe for the package of another 12 patient charts. And what we sell or license is patient charts. Device is nothing, like in glucose measurements. You take glucometer, but actually where all industry is making money in straps. Same here. Right. You take some holder that generate data, and they subscribe to this data, to keep this data, to analyze this data for each patient separately. And this is where we have 1000% of management.
Excellent. So you are doing the intelligent bit of the whole ecosystem. That's great.
Yeah, exactly.
Fantastic. I love the way you have identified the niche.
Yeah, this is in addition to CRAS, clinical reporting as a service.
Correct. So CRAS, of course, is an amazing thing. We're going to be talking about it in much detail in the follow-up questions. For now, let me move to Dennis and ask him about the challenge. So Dennis, what are the challenges you face when you go to a patient or even a hospital to pitch your virtual assistant, your virtual friend? How do people perceive it? How do people receive it? What are their comments, reviews, and feedback?
Well, we're actually earlier stage than that, okay? And but you're asking about challenges in the healthcare field. So our biggest challenge has been to engage with the healthcare field. Okay, it's pretty significant. Okay, it's something that I didn't expect when I started up the company, but now I understand what it's all about. Okay, so number one, Canada is sort of slow to adopt digital health. I mean, COVID has changed everything. Okay, and things have progressed. Okay, but so Canada's a bit slow with that, and in my province we're a little bit behind as well as some other provinces. Okay, so that has been my biggest challenge, is to engage with the healthcare field. Now things are changing. Okay, just again with COVID, with virtual care and all of that, the healthcare system has adopted that, and now there are organizations that are out there that are helping startups like me, digital startups, to connect to the healthcare field. Okay, but it was very difficult for me to actually knock on doors and do cold calls. Okay, so that was the biggest challenge. I have been fortunate to have met two healthcare researchers, and made some progress. Okay, but I really was looking forward to making further progress with the healthcare field. But as I say, today is like a separation. Okay, because we've been busy developing our virtual friend. Okay, we're very close to it. We're going to start rolling it out in a week or two. Plus, as well, it's just over the last month or two, several organizations in Canada have been created that are meant to help people like me. So I'm looking forward to the near-term future as well as the future.
Excellent, fantastic. So yes, I mean, you mentioned a very good point that you cannot go door to door and do cold calling for adopting technology in the healthcare space, and people are not just gonna jump it that easily whenever you launch it. So it has to be a collaboration between different organizations, different institutes, and different research fellows who can actually give you the kickstart and take your virtual friend to the everybody's neighborhood and everybody's door. It's an interesting point, Dennis. What are your numbers? Do you have any numbers? Are you guys looking out for funding right now?
Well, from points and numbers, we don't have numbers. We're still pre-revenue as well. Okay, so numbers and money. Okay, but as I say, so a little bit more about our history. Okay, what we've done. We started off developing a medical device. We learned the stringent regulatory approval of getting a medical device to commercialize it. Okay.
Mhm.
And that's fair. I understand. Okay. Like, I mean, you're putting, could potentially be people, at risk. So I understand that. We learned. It's been a learning journey. Okay. We're
No
electrical
doubt.
engineers. We're not healthcare people. Okay. And that's part of this challenge of having not being able to connect as much as we want to do in the healthcare field. We wanted advisors. We wanted people to contribute. Okay.
Mhm.
So what we're doing now is we've moved into the consumer wellness area. Okay, we're not leaving the health area. We're just moving to the consumer wellness area to move forward. So within a couple of weeks, we're going to be rolling out our virtual friend. We're looking for evaluators and testers. So the idea there is we're going to get feedback from people. Now, and again, it's going to be wellness. It's not going to be health.
Mhm.
So we're going to get feedback from that. We're then going to go back to the healthcare field and you say we've got some numbers and now hopefully you can open up the door and allow us to come in and share with you, because what we want to do is we want to do a pilot. Obviously that's
Mhm.
the first thing with the healthcare field. So that's the
Sure.
first thing you do is you do a pilot. Okay. I was fortunate about a year ago to get some funding with a healthcare researcher, and we were going to actually implement in a personal care home. What I haven't mentioned yet is what we have before we have our smartphone version of our virtual friend. We have what we call an avatar. If you know what an Amazon Echo is, it's an object.
Mhm.
So we
Okay.
first created that for people who are not comfortable with smartphones. So we were going to go into a personal care home and have it evaluated in a personal care home. Just then, COVID-19 hit and things were locked down and we didn't proceed with that. So anyway, so we moved our focus to the smartphone app. We feel the other thing is, quote, everybody has a smartphone, and so you download it and you use it versus us having to build our app, our avatars, and provide it. But we're still going to be moving in that market as well.
Mhm. Excellent. One of the great thing you mentioned is that once the COVID hit, you change your product segment, you change your offerings, you pivoted a bit. So for all the viewers, this is the best thing to learn from Dennis. I mean, I have learned so much. Couple of things I just want to point out is that you gotta pivot if things are not moving in that direction.
Correct.
Dennis did. He is an entrepreneur. He knows that if plan A is not working, let's better move to plan B. If plan B is not working, don't stop. Hustle continuously. He has been a hustler throughout his life, and entrepreneurship is all about hustling and looking out for the options or the plans which work better for you physically, mentally, monetization wise, and everything on each and every parameter. So Dennis has been continuously changing the way their life elevated wants to project themselves in the market. Started with the product, developed a mobile app as well, and then because COVID hit, you cannot reach out to the markets with a product like EcoDot or something, which is also capital intensive, and now move to a virtual friend mobile app. So that's great, Dennis. Of course, you're gonna have success, a lot more success. I have my wishes with you, and I'm sure everybody in Canada and across the globe would also love to try your app and see how they get motivated from your friendly voice alerts in the future. Look forward to it, Dennis. Thank you so much for sharing
We
that
love
story.
that. Okay. I mean, what motivates us is yes, we want to be successful. But
Mhm.
but really what I'm looking forward to is somebody, contact me and say, I've used your virtual friend. It's helped me. I'm looking
Correct.
for that satisfaction as well. So, and that'll come. We know it will
Absolutely.
come. Yeah.
It
Thank
will
you.
come for sure. It will come because your desire is personal. You have a very personal reason to build this up, and
Yeah.
this feedback is going to come from everybody. I'm sure.
Thank
Thank
you.
you so much for sharing that. Over to you, Leon. So, Leon, you have been an inventor for almost 30 patents. What's your take on patents and tech innovations and this entrepreneurship? How important is patent for any tech company?
It depends what you're doing. If you are doing software, it's
Mhm.
not important. Patent is not so important. It's important mostly implementation. If you're doing hardware, definitely you have to build some wall for other newcomers, and that's why you have to build the patent. And if we're talking about technical company based on some hardware technology, you have to to make patent in the beginning and then to start to implement. When usually for software companies, they do software first, and then they understand how it works, because in the beginning they don't understand what they're doing. They figure out the model, architecture, and just then they do the patent. So this is the main difference. But actually it depends on the company. It depends what they're looking for. I'm not sure that today patents is so important in the beginning of the company. Again, if you're not doing hardware is important. But also for the hardware, I'm not sure it's so much important today. What's important really for company that differentiate one company from another? It's a level of implementation and support. This is crucial today, because all the platform, everything is the same. Again, you can find 1,000 telemedicine companies, like 100 many companies. You cannot recognize the difference, but actual difference in support that they offer to their customers or consumers, B2B, B2C. This is where you have, I think, most of the IP should be in how it's built support, and also software, finally.
Yes. So a couple of things which you mentioned is patent will basically make a wall around your idea. It will not stop others to copy you directly. They'll have to jump this wall, right? It will protect your niche, whatever niche you have, be it software, be it hardware, be it a combination of software, hardware, which is again very popular these days. If it's patent protected, you can command premium over whatever you are offering. It will create a barrier for entry and barrier in the competition as well, which will help you to solve a lot of problems. Again, interesting take on the implementation side. I mean, if you just have a patent, doesn't matter, right? Nobody's gonna care about it unless and until you implement it. The moment you implement it, you also need to give a support so that people recognize it, people value it, and people value your services, whatever you are offering. And that's how actually holistically you move ahead, and that's gonna be contributing to your growth.
Right.
So
back to my scientific life, we did a lot of patents, and any university just generate patents every day, thousands. But what percentage of these patents implemented? They have offices, technology transfer offices, all this stuff. But actually, I think less than 1%. I don't know exact statistics, but I expect from my experience.
Less than 4% is the statistics worldwide.
Yeah.
Less than 4.
It's not implemented. So all these patents is just, I don't know, it's a
Absolutely. I mean, that's what as a patent attorney myself, I also tell the same thing to all of my clients, saying that if you are really passionate about something, you want to build a product out of it, you want to serve the community, go ahead, patent it first so that nobody else can do the same thing and you can stop the competition. But if you are just filing patent for the sake of filing it and just putting your name on the paper and putting it on the Google search, please don't do that, because it's going to waste time, it's going to waste resource and everything. I mean, patent without implementation is just a piece of paper, right?
So every day I meet and I deal with investors. You know, like any startup, we are in a constant, for the last 10 years, we are in the constant money raising mode. That's important. And for the last 2-3 years, maybe I was never asked about my IP. We have 30 patents in this company. Never it was asked by investors, explain IP, what you have there. No, they don't interested about it.
This is a surprising take.
Yes, at least in the first couple of meetings. Then, if they do due diligence, then definitely they get very deep inside. They ask, what is it? How does it protect? Some check that it's really protected. And we have very unique patents because we hold real estate on the wrist. All our device, all our sensors are around the whole board, and all our patents just support these technology and protect this technology. And as we know, you can have medical grade measurements only around this place. There is no big arterials, venous blood. So it's a very clean signal we have at this place, and we protected by 30 patents of different, so also design patent for the device itself. But actually, in the beginning, investors, they don't care about patents. They care more about business model. They care more about market, and today about revenue.
True. I mean, again, very, very interesting insight here. Investors would go deep into your product once they, of course, have interest, once you have their interest, once they see the value in the business proposition altogether. And the moment they start going deeper, IP is the thing which will catch their attention, and they'll do due diligence. They will look at in which countries you have filed the applications, where all your patent can stop competition. If you plan to launch your product in 5 countries, do you have patents in those countries? All sort of due diligence will happen once investors gets on board and starts to do his due diligence. And if you do not have checks on those patent side, on the IP front, on the legal front, you are of course going to land in some trouble as well. There will be to and fro with investors too.
But this is not what makes investors excited, actually.
True. Of course, so investor, as you started in the beginning.
Level, yeah, you have to improve the dopamine level by your invention, and this is not what does this job.
Have an interesting problem. Have an interesting problem identified. Make a kick-ass solution. Implement it so beautifully that your investors love you. The moment they start loving you, they'll go deep into your products and your tech stack, and also look at the legal side of things, look at the IP and everything. But of course, IP is not going to interest anybody at the beginning. When we go to our clients or our prospects and they would like, don't come for the IP, that's our last priority. But when it comes to raising much more funds, then of course, IP can help a lot for any company to grow. So thank you so much, Leon, for sharing that. Moving to Dennis about IP investors and your conversation which you would have in the past as well relating to IP. How do you look at patents or IP for any tech company who are into stealth mode or who are just starting up?
Well, if a startup has intellectual property, I think they should look into creating a provisional patent. I mean, that's what I did. Okay, way back when I first started the company. Okay, I came up with intellectual property. Okay, I put in a provisional patent. I hired a lawyer in Silicon Valley. I went through the process. We looked at patenting in US, Canada, and Europe. We went through the whole process. Okay, and I'll come back to the learning experience. Okay, so there were things that I could have done that could have improved the outcome, but it was a learning experience. But no, we believe strongly in intellectual property and in patents. Right now, what I haven't discussed yet is the next phase, sort of our virtual friend. So a virtual friend collects data. So in the future, once we have enough data, we're looking at applying machine learning and AI to the data to do predictive analytics. Okay, so when we get to that point, we intend to, we consider that very strong intellectual property, and we will be looking at a patent with that. And also, just to say, we also have a trademark. So we have gone through the trademark process, so we have our own official trademark. So I believe intellectual property is important, but I agree with what Leon has said and what you've said, and that is, investors initially look at what you have, your business model and all of that, but they will look at your intellectual property. So it is something that you need to consider if you have intellectual property.
Correct. If you are into tech business where you see that people can easily copy you, people can easily reverse engineer your product offerings, you must have it, because you can no longer keep things secret in these days, in the age of data, in the age of open source. It's next to impossible to keep things secret, so better to protect and enjoy a monopoly for next 20 years on any particular idea. This is what we would also advise to a lot of folks. Yes, excellent. So, love, Dennis, you had this clarity in the beginning itself, and you applied provisional, non-provisional, and you had identified target markets as well, where you wanted to launch file the patent application. This is great. So now we have discussed among, I mean, a lot of things. We have seen, we have touched your professional journey, your personal journeys as well, the inspiration which motivated you guys to start your own Oxytone or Life Elevated, be it a smart medical device which people can wear around their hand, or be it a virtual buddy which can always motivate you by providing friendly virtual assistance. This is the time where I like to open the floor to both of you. And if you have any questions, you can go ahead, ask the question to each other, or if you want to shoot some questions to me, I'm here to answer. And at the same time, if our audience wants to ask any question, go ahead, shoot those questions now. We'll be happy to answer all of them. So the floor is open. Leon or Dennis, if you wish to go ahead, ask question to each other or me, this is the time.
Well, with Leon, I don't have a question, but it's more a statement. Okay. Again, as an entrepreneur, you come up with all kinds of ideas and capabilities and all of that, and then you have to focus. And that's what we've done. We focus on our virtual assistant standalone. But certainly we see the capability of augmenting its capability with wearables or with apps on the phones. Okay, so at some point in time, Leon, I'll be contacting you about your wearables. I've researched a little bit. Okay, right now it's focused on your Prime application, but I see that you're working on adding additional capabilities and functionality to it. Okay, so that interests me because, as you pointed out, there could be 5 parameters you're monitoring and could be 5 devices. And what you've done is integrated it into one. So anyways, it's a comment. Leon, who knows, maybe in the near future we'll be working together.
Maybe I would love to. Also my question, do you have polychronic patients in your patient cohort? Polychronic patients.
What kind of patients?
Polychronic patient.
Polychronic.
One patient with multiple diseases.
We are targeting that. Okay. Again, we haven't moved into that space because we're looking for healthcare researchers to work with us to have pilots. But yes, okay, we believe so. Initially, so we've shifted from medical device to health device to wellness device. Okay, we want to get traction in the wellness area first. Maybe I'm making this a long answer, and then we want to start moving back up the chain. So yes, the answer is yes. We definitely diabetes. Okay, like diabetes is such a target market to go after, and respiratory issues. Okay, so yes, definitely we want to move back into that area once we get traction.
Wow. So I would love to help anytime.
Great.
And so let's do something together.
Sure.
Interesting.
I like your company. I like your project. It's applications. Okay. Such applications very important.
And we do want to move into the States. Okay, right now we're focusing on Canada because we're familiar with the territory, but my brother is in California. So we're looking at creating a head office here in Winnipeg and one in Silicon Valley. But again, we want to get some traction first, and then we want to really get into the US, Europe. Now through Proton Legal, I'm now starting to get interested in India, through your previous speaker. So anyways, I think it's a very exciting thing. And with Zoom and the capability to connect all over the world, it's very exciting to be an entrepreneur at this point in time.
Yeah, that's very exciting. By the way, we thought about how to penetrate into the Canada market, but actually we decided not to do it because of very tough regulatory issues in Canada. Right. We was surprised when we learned about this because why? So what was the issue? Why they did such a tough
you would want to have a guy like Dennis. You would want to have like guy like Dennis in Canada, and your life will become easy, for sure.
I'm looking at networking. Okay, I mean, I want to network. I'm excited to work with other people, with other companies. We can work together. So yes, I'm very much open to partnerships.
Excellent, excellent. This is what we love about our webinars. In our webinar as well, 2 folks, one from Israel, one from the US, got in conversations, and they eventually ended up doing some meaningful, constructive business together. And here again, we have Dennis and Leon exchanging projects, exchanging thoughts, and discussing future collaborations. This is exciting for Ron as well as for everybody from Oxytone as well as Life Elevate.
Frank, I would like to add that we have good customers in India as well. Recently, a couple of hospitals started to use our product in the hospital. This is what we didn't expect.
Mm.
Yeah, so because our product is dedicated for hospital at home, for home use. And recently they tried, they succeeded, and they like it. So we think to extend our presence in the hospital. Oh,
well, looks like we've lost him.
looks like lost him.
So now you're the host.
I'm a host. That's great. So, yeah.
Keep on talking. Please keep on talking. I mean, I didn't realize you were actually doing work in other countries as well. So
yeah, we are doing work in Europe, and Ascom is our main customer and distributor in Europe. We are working in United Ascom Europe.
Okay.
It's the biggest telecommunication company in Europe, and they have Digistat. It's a very advanced telecommunication platform for home monitoring. And last year together, we helped a lot in Italy for COVID patients and post-COVID patients.
Oh, so you're very international.
Yeah.
Wow.
Yes, so we try our best to help everywhere where it's possible. It's quite difficult. So our next decision to focus on specific countries, and currently we try to help many countries because of COVID, and our product is very, very important for today.
For sure, no question. And it looks like it's continue a little bit with Delta. So
yeah.
Lovely. I'm so sorry I got dropped when you asked question to me, Leon. Can you please repeat that question?
Yeah, it's not a question, just I shared that we're working with India. So recently a couple of hospitals applied to us, and we built very good relationships, and they start using our product in the hospital and our support as well, and they're happy, it looks like. So we're going to extend our presence in India.
good stuff.
Excellent. Would love to help you if you need anything when it comes to India. Do give me a buzz, and we'll be happy to help you out on the ground as well.
Yeah, thank you very much.
And of course, the product is fantastic, and that's the reason why everybody is adopting to it. So India is, of course, it's a place with 1.5 billion people, and we still want to make your concept of taking hospital to the home. We would want to have that. There's no question about it.
Thank you. I appreciate it. Yeah.
Excellent. All right. This brings us to the end of this panel discussion. We had fantastic talk today. We discussed how Oxytone is has vision to bring hospital to your home by identifying different parameters from different patients and providing a combined index so that polychronic diseases can be adequately dealt with for all the patients. Leon shared, you shared your life journey with us. Thank you so much. You also shared your personal journey and the reason why you came up with Oxytone in the first place. So is the case with Dennis. Dennis, I mean, I've been talking to you for the last couple of days, and you have always been giving a lot of energy. I'm learning from you each and every time I talk to you. You are an hustler, you are an entrepreneur, and
I learn as well. Okay, that's what's so great. Okay, it's an exchange of information.
Thank you.
And I love that. Okay, this is a terrific.
Thank you so much, Dennis. And Dennis is a 360-degree networker, by the way. If you want any help in any sort of thing in the life, you can always reach out to Dennis, and he will help you out. I'm sure. It's his passion to help out people, and that's how he came up with this concept of providing friendly motivation to the patients in their tough time when it comes to healthcare or healthcare services. So thank you so much, gentlemen, for coming on board. This was a fantastic discussion. We're delighted to host you today. Look forward to the future discussions, conversations post this event.
Right.
Thank you, Frank. You're fantastic
MC, I guess.
Yeah.
Thank you so much.
Yeah, it's been great. I really enjoyed myself.
Yeah. I enjoyed our conversation as well very much. Still in touch.
Great,
We will be in
great.
touch. Yeah. Keep in
Yeah.
touch.
Yes, let's stay in touch for sure. All right. Bye-bye, guys. Thank you so much.
Thank you.
For signing off.
Thank you.
Priyank and welcome
We'll
for
see
Tom
you.
Beagle. Yes.
Okay, thank you.
Bye-bye.
Bye.